Trust is an ICT for health organization. We're using information and communication technologies to support provision of healthcare services so that there's improvement. And in principle, we develop, deploy, support, and maintain electronic medical record systems in both the public and private health facilities, particularly the ones belonging to the Christian Health Association of Malawi.
Yeah, it was started back in 2000. Then our founder, now Dr. Jerry Douglas, was working here in Malawi as a VSO volunteer, observed how systems were being developed and how they were not really working in Malawi. He looked at the systems that were using traditional computers and noticed how they were not fitting in the environment that we work in. They were using traditional QWERTY keyboard and mouse, which were hard for people to use. They had a lot of moving parts. They were not developed by local developers here. We took the approach of implementing point of care health information systems by repurposing devices that usually be used in retail shops, the point of sale terminals, and turning them into point of care workstations for clinicians and healthcare workers. And that resulted into the system that has now been scaled up to the major health facilities here in Malawi.
So in terms of successes, we've managed to help government to have nearly real-time data collection and analysis of finally age disaggregated data. So this is required to ensure that available resources for the national HIV epidemic response are promptly targeted to key subpopulations. And by the end of quarter 2019, that's January to March, we had managed to scale up our EMRs to 193 facilities across all the districts of Malawi. So this implies that we are accounting for over 70% of the national HIV cohort in Malawi.
Baobab has been a catalyst for change in Malawi, the health sector in Malawi, in the area of digitalization over the past 15 years. And we are proud because Baobab is a local organization. It's a Malawian and fully owned by Malawians. So they know they are working within a context they understand quite well.
The system has two parts. We have reception system and analyzing system, like the system that we enter the results. So first, when we have a patient or a client, we register the client into our system using a reception mode. where we enter details of the patient. That's a name, age, sex, location, requesting physician, requesting department, and also enter some other detailed information. From there, the information goes into the system, and we generate a barcode. So the barcode is being used throughout the process of the sample.
Initially, we were having manual system whereby we were entering the data manually, but now since we are having a laboratory information system that was installed by Baobab, I think things have changed. The data that we have, we use it to make decisions as a nation. Even when procuring some of the reagents that we have in the laboratory, we use it for quantification to know how many patients we are having in a month or in a year, and then we can quantify the reagents that we need as a laboratory. We are capturing data very well as compared to when we were using manual capturing of the data. Now we can follow the data easily.
First of all, results cannot be lost, right? Because these results are captured into a system which is permanent to a greater extent, right? So computers, so it can stay there for years. So let's say I leave the results today to the patient, and maybe somewhere along the way the result got lost. The doctor cannot make a decision to treat that patient. They can always come back to look for that result. And I'll go into my computers, into the system, I'll get that result, and I'll make a reprint. I'll print a copy. They'll be able to do that result.
Information that one will need regarding a particular person in relation to ART services is stored here. And I'll just give you an example. We are talking of the regimen that one is taking is also contained in the same information. So in general, there is a lot of information in this system. Even the viral load monitoring, we already talked about the viral load monitoring. This system, there is a place where you also enter the viral load results. And we know these are the pillars in terms of ART service delivery. One would easily refer to this system to know if their client will collected viral load sample, which if you talk about the ART service delivery, these are the most important thing that we need, that we will need, a system like this one to contain.
I think having a system like this helps us, especially in retention of our clients, because the fact that we're able to keep this information and put it up whenever we want, we're able to trace these clients. In terms of searching for people who have defaulted, you can come up with that information in seconds on this system, so we're able to go and trace them and send people out to go and look for those clients so they're not lost. Whereas before, it would have been a very long, daunting process to find those clients who had defaulted. So yeah, it helps in retention a lot.
Well, at the end of the day, you know how many clients you have attended to, and you know which kind of regimens you have dispensed and how many. If we know how many patients are in that ART clinic, that helps us a lot, especially in terms of drugs. So you can't run out of drugs, because each time you have a report that is really sound, going to HIV unit, then drugs to us depends on the right report. In terms of reports, so every quarter the system is able to capture all the variables that we enter in the system, and then come up to generate a cohort report. It's really helping us in terms of monitoring the ART program.
it is easy and safe to keep their data in terms of confidentiality of clients as compared to using hard copy files and registers whereby somebody can access to that information and the confidentiality of the patient can be violated. It's also easy to retrieve the client's data as compared to the registers which we are using and the files. It also works in it lessens the workload. Because for the files we were using previously, we were supposed to look for the files, look for the registers, but now we go straight into the EMR and retrieve the data, then workload is lessened.
We're also looking at standardized care and treatment for all ART sites. You don't want to have a situation where one site is offering a different kind of treatment and care model from the others. So the EMRs help to ensure that there's that standardization across all the sites.
At the end of every month, we have got something and we can write the report. That is consolidated report, that is monthly, quarterly or biannual or annually, because we have to see how we are performing. Because we have to use this data for ourselves, not for others, so that we use it at the end of, we have quarterly meetings where we meet and we can tell others how far we are.
This system is helping us in terms of the legislation that's happening here at Queen's, because we are registering all births happening at Queen's. So we are able to capture how many babies have been born at Queen's. On average, we do register 40 babies per day, because on average the deliveries in laboured are 40 babies per day. The system is easy to use because it's friendly, and for those who can maybe being oriented within a day can be able to use the system. And with the use of the filling of the form and even the use of the electronic system, I prefer using the electronic system because it's fast.
Mu system yetu masunga information ya ana mina bado bachipata badasanje mwana wina isamino bado bachipata sanje timayenera kumulo bilimba mpasa birth certificate nde tikamali bazimene zijazo timadziwa zona kuti kodi pansanje ana mina na bado ndangati komanso pamwezi ndo timathakudziwa zoti tindana ochuluka mwakuti amene anabadwa komanso amene tinapasa ma birth certificate kuti ndamwakuti amene sanalimbitse so ndi mwakuti ndio zikudziwika kunena kuti nzika zamalo zokumadziwika kuchoka pamene popo papanoko system ikutithandiza kwambiri kuziwa zabwino.
Previously, we were printing the birth certificates from the center, which is the National Registration Headquarters in Lilongwe. But currently, as of now, there are some steps which have taken place where we've decentralized the printing. So currently, I'm able even to print here at the district level. The moment it has been approved in headquarters, so I'm able to print it here. The printing that is being done here to us is a milestone because there are other people or the other children who will require that certificate on demand, or probably they're traveling to abroad. Let's say if they're going for school or they're going to another country. Now it's a requirement that any child that is moving out of the country has to have the birth certificate as one of the primary identifier of that child. So for those cases, instead for us waiting for the record from the headquarters, we're able to print locally here at the district level. So it has reduced the time on such clients waiting for their certificates, unlike the way it was at first.
patient comes into the hospital, this is where registration takes place. We register the patient starting from his or her name, where he or she is coming from, age, marital status, and the geographical position of where he is coming from, by using any landmark which is close to this area.
We use it when we want to prescribe medication, or sometimes we might even use it when referring them to other places. For example, if they are referred, they are admitted to the ward, we can still enter them. We have admitted them, or maybe we have referred them somewhere. I feel like sometimes it simplifies our jobs whenever we are using it, because it's easy to find what you want because it's already there in the system. So you just search for it and you find it.
Of the month, we have to capture the reports. There are some indicators which we need to capture through the ANC reports. So by the end of the month, we can easily get those reports rather than counting. In the past, we are using the register. So if we are using the register, we count starting from one. Each and every page, we have to count the patient till the end. But if we are using the electronic data, the electronic system, we just capture, because all those indicators comes at once, rather than the registers.
This system is really helping us because it's easy to follow up the patient when you are taking history. It's in detail. The detail that is in this system helps us not to miss any information when you are assessing the antenatal mothers. The other benefit is that it's easy to retrieve the information. Like when the client is coming for the second visit, you can easily follow up and compare the data that you entered last time and this time, so that you should know how the woman is progressing antenatally.
Having seen the impact of the EMRs, as a facility and as a district as a whole, it is our wish and a vision to have all these systems installed in almost every other department within the hospital, and also health facilities throughout Mangwaji district. Since now it's only a few health facilities that have the EMRs in Mangwaji district, and even here at the hospital, it's only a few departments like the OPD and the ART, but we want almost all the wards and departments to have the EMRs installed.
The EMR is helping in terms of drug management because we are able to extract the statistics from the EMR to see which common conditions are we getting and how many of those conditions are we getting in a month. Through that way, we are able to optimize in terms of buying of the drugs. If you saw 100 patients, you are going to be given drugs for 100 patients as well. So through the EMR, we're able to plan as to how much drugs we're going to order and how much drugs we should expect to receive.
We don't want to be keeping on asking you similar questions. If you're a patient, we don't want any time you come, we ask you where are you coming from, all sorts of, we should have baseline data. And when you come to our facility, immediately we scan your barcode, we know who you are, and we get all your information with us. At the same time, we should be able to track you. You know, we've got issues of drug privilege, or sometimes people even moving from one place to another. So we should be able to know, okay, this patient came at this facility, spent so much time, and this was the prescription, they got so much drugs. Yeah, and this was the outcome. Even at a community, we are looking at maybe 5 years from now, it should be easier now with the interventions that we are setting up for primary health care as well as non-communicable diseases at a community. Also, we are looking at electronic medical records as an opportunity to open up a market for Malawi to hardware, software development, also support human development capital. Finally, probably I must also highlight that with lots of insurance companies coming up, also the idea, the plan for government to introduce a national health insurance, we want to be able to track patients and how they're accessing care in facilities. So essentially, it's a new thing, but there are so many areas that Malawi is expecting to benefit.
But it's also aimed at enhancing the national level resource planning, for example, commodity and services. So the Ministry of Health through Department of HIV and AIDS is able to say, okay, for this quarter we managed to see so many HIV patients, and then they can use it to focus the kind of commodities that they need, the medicines, the condoms and all that, to cater for the various aspects of the HIV treatment, whether it's HTS, they will need this kind of commodities, the actual treatment, who is on which regimen. So that information is very critical, and it helps also to avoid the wastage of resources, because then you don't procure more than what is necessary, because the figures from the EMR will give you an estimate. It will actually even also show a trend in the growth in the number of people that are joining the treatment.